Hi, Paul Sakis, Good News Broadcast, speaking to Dr. Mark Duncan. Hi, Mark. How are you?
I'm doing great. How are you?
Okay, good. You're a DDS. I guess makes you a dental doctor? Is that right?
Exactly.
Okay, and an LVIF, which is?
I'm a fellow with the Las Vegas Institute. It's a postdoctoral training facility, and so I have passed a comprehensive examination over the core curriculum and basically validated my understanding and knowledge of neuromuscular dentistry.
Okay, neuromuscular dentistry. Okay, we're going to talk. This September is a National Pain Awareness Month, and here's a thought to chew on, they say here. Pain keeping people from work may have caused by their bite. Okay, so, well, it sure doesn't. It's no bargain to have pain in your mouth, right? You can't talk, you can't eat, or you somehow try to figure out how to do all these things, but it's not a bargain. So, I mean, how, besides a cavity or root canals things, what other kinds of things can happen in the mouth?
Well, that's the kind of funny thing about it. When we all went to, well, not we all, but when dentists went to dental school, we were taught how to look at things inside the mouth, and our focus was confined to the mouth, but then it was further confined just to the teeth. And so we got very, very good at looking at problems in teeth. And if you've got a toothache, that's what we do. But the problem is, patients aren't just teeth in isolation of everything else. There are problems that you can have in your mouth that will cause pain in places like maybe in your temples, in your forehead, in your neck, in the back of your head, or as far away as lower back pain and your fingertips. And so if we look just at the mouth, then we're missing the bigger picture. And the bigger picture is what people suffer with. You've got patients and literally, it's about 20 to 30% of the people walking around out there, adults, are dealing with pain, if not on a daily basis, then at least on a chronic, maybe a weekly or monthly basis. They're dealing with pain that they don't have to. And so that's what a neuromuscular dentistry can help with. And that's kind of why on this National Pain Awareness Month, we wanted to help get the message out there that people who deal with migraines or neck pain or lower back pain, they really ought to find a neuromuscular dentist and see if that's a part of the problem.
So this is caused from some aspect of the face. We're not talking about, you have a pinched nerve, it's back down in your neck. We're talking about facial concerns that causes the pain down your neck. Is that right?
Yeah, that's exactly right. And as a matter of fact, because the way that we're put together, our mouth is basically a snorkel that we breathe through, the mouth and nose. And if your lower jaw is in the right spot, then your snorkel stays open. If your lower jaw is in the wrong spot, then there's a pinch in your snorkel. And so we will actually move our head into a bad position. And you've seen, the 150-year-old guy walking down the street whose head is so far forward that it looks like he's going to fall over. Well, what he's trying to do is open up his airway, and that creates problems in the spine, and it can actually create a pinched nerve in the neck because of his bite. So, when we're looking at what's happening in people, it's not just the 150-year-old man who hasn't had teeth for 50 years. It's also the 20-year-old kid who's, for the first time in his life, having migraines, or the 32-year-old mom who is yelling at her kids because she's got such severe pain in her head that she can't think straight, but her doctor tells her everything checks out fine. She's had MRIs, she's visited with the neurologist, and nobody can find anything wrong. And so she is written a prescription for Imitrex and told that this is all that medicine can do. But the problem is, it's not a medical issue, it's a dental issue, and most dentists weren't aware of it, and so it's just the neuromuscular dentist that she has to find.
So now what would you do? I mean, and first of all, so I come in with you, I have pain in my head, I'm having headaches, but there's no tooth. I don't feel a cavity or something else pain. And so I guess the first thought is not to come to you, is to go to the neurosurgeon or somebody. But you're saying there's a dentist who. So what are the kinds of things that you would do?
Well, the place that it starts is we would do a much more comprehensive evaluation. In dental school, we're taught to look at X-rays of teeth and taught to put, the dreaded pick and poke on your teeth, and we look for holes in the teeth that we can fix. But what I would do that's different now than when I got out of dental school is I would also explore the muscles of the face and of the mouth and of the neck and of the shoulders, and we would actually palpate the muscles in the mouth and find out, are these muscles paying a price? If they're tender and sore, then we ought to look for why. We also can put surface EMGs on, and like if you went to your heart doctor because you were worried about heart disease, they would put an EKG on you and measure your heart muscle. A neuromuscular dentist can actually measure the EMGs in the muscles of your bite, and they can find a place where your jaw should be so that all the muscles are comfortable, and they would develop an orthotic for you. And that orthotic would simply support your bite so that everything is in neutral. And then we would watch the pain unravel. Your migraines would become less severe or completely disappear. Your neck pain would go away. You would actually wake up rested. For some patients, I've had them tell me that they've started dreaming again. They hadn't had dreams in 15 years, and all of a sudden they're having these wonderful, vivid color dreams. And there's a lot of downstream things that happen because of what's happening in the mouth. And as a neuromuscular dentist, we're trained to evaluate that more complete picture and see if we can offer more complete help.
ENG, you said ENG?
EM, yeah, it's electromyography, and so we actually record the amount of muscle activity. And so, like, your big jaw closing muscle right there on the side of your jaw, or the jaw positioning muscle, and this is the interesting one, the muscle that guides your jaw forward or backwards or side to side so that you can get all your teeth together, that lays right underneath your temple. And if that muscle has a cramp in it, we don't call it a Charlie horse like you would if it was your leg. We call it a migraine headache. But the job of the muscle is to guide the jaw. And if it's having to guide the jaw into a bad position, it cramps up and it hurts. If it guides the jaw into a good position, then you don't have any trouble.
TMD is?
TMD is a big umbrella term that kind of describes all of these different issues, and it stands for temporomandibular disorder, which means disorder of the temporomandibular joint, which quite simply is just the jaw joint. And so problems related to that would all fit into this category of TMD, which is something that, again, we were taught to look at hard tissue, but it's not about the hard tissue as much as it is about the entire body. And so a neuromuscular dentist has extended their training to include soft tissues and, most importantly, the muscles and airway.
My yoga instructor just yesterday emphasized and spoke at great length about something that she thinks is helpful, and she's learned from Qigong, tongue at fire point, putting the tongue behind the two front teeth, and there was a controversy of it. It's not the gum; it's called something else, right behind the teeth, on the upper part,
palate, probably, yeah.
Your palate on the top there, and keeping it. Actually, she feels almost all day, or breathing in that way, lightly putting your tongue behind your teeth as a way to loosen your jaw. Any thinking in that regard?
Well, I think she's onto something, and that's what we find with a lot of these things that on the face of them seem kind of out there, but when you really look at it, there's a lot of validity to that. The place that our tongue is supposed to be when we close together is in the roof of our mouth. It should be right there, right behind your two front teeth. Mm-hmm. And if our kids grow up with their tongue there, then they end up growing up not needing braces. If for some reason they can't put their tongues there, then they end up needing an orthodontist when they're in their teens, and they a lot of times will end up with chronic pain when they're in their 20s and 30s and 40s. But I think she's right on the money. That's a great place for your tongue to live when it's at rest.
Very interesting. Well, she's a smart one, Claire Diab, and she's Deepak Chopra's guru for 25 years now, and so
really?
She's the head of the Chopra centers all over the country, and she does the program. It's these are good natural kinds of things, but combined with what you're saying, it seems to make a lot of sense. I mean,
yeah, it absolutely does. I'd love to actually spend some time visiting with her, because a lot of the things that they're going to look at are the same kinds of things that we should be paying attention to. It's just unfortunate that our traditional training hasn't led us down that path.
Well, obviously, this Las Vegas Institute of Advanced Dental Studies, of which you're the clinical director, which means that you're kind of overseeing a lot of things here, is a fairly open-minded operation. This is what I'm hearing.
Yeah.
And I've interviewed you guys before. You're open-minded. It's just not about poking, right?
That's exactly right. No, it takes listening carefully to everything that's going on and then putting it together in a way that makes sense.
Interesting. Okay, so and the institute, it's a teaching institute, or is it also a place that people come to get help?
Well, primarily it's a teaching institute, and so what usually would happen is if a patient's having a hard time getting some answers, we're going to look first for a dentist in their area. And so we fully support things like the website that is probably their best frontline resource, leadingdentist.com website.
Right.
You can get some great information there. You can find a dentist in your area there. If you're having trouble finding somebody close, and I know you guys have people in your area, but if you're having a hard time finding somebody, then you can get a hold of us at the Institute. You can go to lviglobal.com and shoot us an email, and then we can help you to find somebody. And if push comes to shove and nothing else is working, and for some people it is actually worth the trip out to fly back and forth to Vegas, then they would come out and we could help them that way too.
Okay, very good. Well, thank you very much. We'll send people over to leadingdentist.com. Mark, a pleasure to speak to you. I'll call Claire and ask her to give you a holler.
All right, that sounds great. Thanks, Paul.
All right, thank you. Take care. Bye-bye.
Bye-bye.